Right, okay. So HRT is hormone replacement therapy. It consists, if you've had a hysterectomy, you only get the estrogen part of the HRT. If you haven't had a hysterectomy, then you need to have progesterone to protect your bone, to protect your endometrium, because estrogen causes your lining of your endometrium to thicken up. So when when you have your periods, as your period, your estrogen levels go up mid-cycle. So an egg comes out and it might get implanted. Then the estrogen levels drop and the progesterone goes up. And that is, if an egg hasn't implanted, that's to make you bleed, shed the lining of it. So progesterone, although you've got it in your body all the time, it's purely there to get rid of the lining of your endometrium, your womb. All your symptoms that you've got when you're going through the menopause are all related to a lack of estrogen. Diet doesn't do, and supplements don't do, is they don't replace that estrogen. So that's what we're trying to do in HRT, is replace your estrogen. So if you think about it, because a lot of people get quite upset about and worry about HRT, and really it is a form of replacing a deficiency. So if you had thyroid problems, you think nothing of taking levothyroxine for that. So it's the same idea as that. So that's what HRT is about. The risks with if you think about the Women's Health Initiative, I think it was it last August, I think it was, there was a big scare again. It was in the newspaper saying HRT causes breast cancer, and that was a big issue. Well, that was all to do with old HRT. So years ago, so say 30 years ago, women, something like 50% of women took HRT, didn't worry about it at all. They were taking the old estrogen, which was made out of pregnant horse urine. So that's where all those studies came from. And what that study also looked at, what they did was they had women who were above 60 put onto HRT. Well, that's at least 10 years too late for a lot of women. And that's where the study came out and said it causes breast cancer. So that's where all those scares came from. Nowadays, we try not to use oral estrogen combined with oral progesterone, because as I showed in those slides, that it's the progesterone that causes the breast cancer. So that's where the issue is. So by using transdermal estrogen, you have fewer side effects. Now, it's the estrogen that can cause you to have a VTE, is venous thrombosis embolism, which is another word for deep vein thrombosis. And that's what estrogen can cause, especially if it's oral estrogen. If you have high blood pressure, there's no reason not to have estrogen replacement HRT, because that will help. That helps in all your cells as well. So the reason that you might get cardiovascular disease if you don't have HRT, and it doesn't occur to everybody, but to people who there might be an increased risk, it probably is worth having estrogel or an estrogen patch with eutigestin. Eutigestin is the progesterone that you want to take with it, because it's one of the young ones. It's made from wild yams, as is the estrogen nowadays. The other thing with the estrogen we use now is the estrogen, the same type of estrogen that we produce ourselves with our bodies. So it's the same type as we're producing anyway. And again, that's made from wild yams as well. Does that explain that a bit more? Okay, so when I go on to the cardiovascular bit, so estrogen helps with your cardiovascular to protect you because it makes our veins and arteries more pliable. You're also less likely to get, it's less likely to cause you to have become diabetic because it stops you getting insulin resistant. But I would say that for most symptoms and to protect your health long term, HRT is a good thing. That's my view. Even if you only go on it for a couple of years, it protects your body for that much longer. And they say nowadays that you don't have to be on it for, you don't have to come off it if you don't want to. And I've still got women who are in their mid 60s, and I've got some women in their 80s who are still on it, and they say they'll never come off it. And that's
Right.
the thinking. They need to be on the lowest dose possible. And that's, as you get older, you need to be on a lower dose. And again, the transdermal estrogens are much better for that as well.